Hello and welcome to MindMatters Masterclass. This month, July, we are really privileged to feature our VIP guest speaker who will be presenting on choice theory reality therapy, also known as CTRT, Dr. Anthony Wong. He is a CTRT specialist, psychotherapist in Singapore over a couple of decades. He doesn't look his age. And he's one of the very few, less than 10 in Singapore, who has been accredited with the William Glasser Institute trainer accreditation. He's also a Singapore Association of Counselors, Counseling Master Clinical Member and Clinical Supervisor. So, ladies and gentlemen, please give a warm digital applause to welcome Dr. Anthony Wong.
Okay, thank you, Glenn, for inviting me to do this masterclass. So this masterclass is really on choice theory and reality therapy. And if you look at the little subtitle, the power and psychology of personal freedom. So what does that mean? I'm going to present to you from two different perspectives today. One, of course, is about the modality itself. What is it about? Right? So why that? So for those who are practitioners, you can get some tips, right? And maybe a glance into whether this modality is for you. And for those of you who are, struggling with your own mental health, there will be some little nuggets that I'm hoping that you can take away from this class as well. Okay. So without further ado, I think I shall proceed to sharing. So maybe for all of you, so reflect on the following. Yeah. Have you been looking at yourself, thinking about how you are doing in your life? Right? If yes, just maybe go into the chat box and maybe type in some of the comments there. And have you been trying to read books, taking courses, and yet still feel a little bit stuck there? Right? Are you still are you wanting to feel more relaxed, confident, and happy, but instead you are feeling very overwhelmed, right? And do you sometimes feel discouraged, frustrated with people, or easily triggered? And if you are, okay, I'm hoping that in my sharing, and hopefully in the future, let's say you do go to any practitioners while using choice theory and reality therapy, I hope that you can bring it up and hope that they can support you in some ways or another. Yeah. So the agenda for today, there are four parts to it. One is the roots and key concepts of choice theory. Right. Second, the five basic needs of human beings. Right. Third, Dr. William Glasser, the founder of choice theory's model about total behavior. And last but not least, strategies and application of CTRT. So people who are practitioners, participants and the learners here who are practitioners, this part will be a lot more relevant to you, right? And I just want to give a disclaimer, right? Just now, Glenn have given a quick disclaimer. This is just 1 hour or less than that masterclass, right? And therefore, this is not replacing the actual training itself, but I'm hoping that it gives you a good introduction. So this is Dr. William Glasser. Okay, he is initially a chemical engineer. Okay, and what happened is, in his career, he realizes that he has this interest in psychology, and he then pursue psychology and have a master's in that. And later on, he decided, hey, I want to pursue medicine. Why? Because he find that traditional therapy or medicine hasn't been quite helpful back in those days. He actually questioned why. And this is where then he developed choice theory at first to help to explain a certain behavior within a person. And subsequently, what happened is that he decided to then invent this therapy called reality therapy, which is grounded by choice theory, to help people be able to help themselves as well as to help others. Okay, he has produced numerous books, and he has established an institute. Also in Singapore, there is one, who is governing how the choice theory trainers and practitioners are practicing in Singapore. Yep. So the roots and key concepts of choice theory. So choice theory is a psychology of internal control, which emphasizes that all behavior is chosen to satisfy one or more than one of those basic genetic needs. And I want you to, hold your horses, about what are these 5 basic genetic needs. Some of you who are practitioners may already know, but hold your horses. Yeah? And some of you might later on want to ask me, like, what do you mean by all behaviors are chosen? I will answer that too, if you do have that question. Yeah. So the core principle behind choice theory is about the only person whose behavior we can control is none others but our own. So we are always responsible for our own choices, even if we don't always feel that way. Okay. And so we talk about internal control psychology, right? Which means there is something opposite of that. That is the external control psychology. Right? So what is external control psychology? Let's have an understanding about that first. It says that, it's the other way. So there's a little bit of an error there. So this one that you're seeing here right now, right? This particular one is internal control psychology. Internal control psychology says that the only person I have control is who? None others than myself. And all long-term psychological problem is about relationship problem. And what we do oftentimes in internal control psychology is to ask us that question, very difficult question. And that is what I am doing getting me closer or further away from what I want? Okay. And the other one is the external control psychology. And if you hold on to the external control psychology belief, you will hold on to these 3 beliefs. The first, I know what is best for you, and I'm doing or saying things that is for your own good. And this is so destructive. The first one here, this is so destructive because it's about us justifying even when we hurt other people, right? And the second is I can control or change people. And what happened? What happened here is when we try to control or change people, the issue is that we get frustrated because people change only if they want to change. And the more we want them to change and the more they don't change, who's frustrating? No one but ourselves, right? And the last one, others have control over me. And this one is when you give away your autonomy, your control to people around you. And you give away your power to be able to do something, right? And this is all the external control psychology. Once again, I'm sorry for the error, so we swap over. Yeah. And if you believe in choice theory and reality therapy, there's these 3 concepts here, the 3 R's. Okay, the 3 R is reality. The second R is responsibility. The third R is about right and wrong, right? And what does this mean? Reality, it's about what's happening, what's really happening right now, right? And the right and wrong is about evaluating your behavior. Is what you are doing getting you closer or further away from what you really want? And if you were to choose a behavior that gets you further away from what you really want, are you okay or not okay about it? And if you're okay, then you take responsibility because the impact of it, you have made a choice that this is something that's going to destroy the relationship, for example, right? But you're okay with it. And then you have to take on that responsibility. But if you are not okay with it, this is what we call the stopgap measure question, right? Is what I am doing really bringing me closer or further away from the relationship that I want? And if it is further away, okay, what am I willing to do that helps me get closer? Right? So right and wrong is whose judgment? Is your own evaluation. So as practitioner, what happens is we don't tell client what is right, what is wrong. They are the one that will take that responsibility through the evaluative question that we ask. This is the art and craft of CTRT, the essence, and I'll talk more about it. Yeah. So I just want to share some myths and to help really align some of your thoughts for especially those practitioners. So I've heard all these myths, right? Like choice theory is telling people that you have a choice and you should choose something else. It's not really. What the practitioner does is the choice theory itself is descriptive. It explains why we behave in a certain way. It is not prescriptive by telling you what to do. So our role as practitioner or individual is to understand dig very deep into what is happening to us, right? What is the need that we are trying to meet? And is it really helping me or not helping me with whatever that I'm doing right now? Right? That's the that's it's not an external instruction, but really a self-reflection or self-evaluation. The second myth that I've often hear is like, choice theory cannot be used for certain population. Example, people who are highly resistant, those who are in crises, or people who struggle with mental health. For practitioners, mental health practitioners out there, choice theory is universal because it talks about human needs, right? And every human being is driven to satisfy these needs. Again, hold your horses about what these needs are, right? And it's applicable. It is always applicable. Any modality, in fact, right? It's the depth of understanding and the skills of the practitioner that adapts to the different situation. And so even in crises or, different kind of mental health issues, it is the understanding of the practitioner ability to execute CTRT that will help the client. Okay. It has nothing to do with the modality itself. And the third myth is choice theory suggests we ignore external challenges, right? Or that the individual, the person who's struggling, is to be blamed for the struggle, right? But in reality, choice theory is helping the client to empower. I'm not saying that you make a choice and you are doomed. You are to be blamed for that choice that you make. You are so silly about doing that choice. It's not about that. It's about, hey, there is something underneath those things that you are doing. What's that thing that you're trying to meet? Are you seeing it or not seeing it? Right? If you're not seeing it, can we try to surface it out and try to understand what is it that we are dealing with here, right? It clarifies that while we can't control others or all external events, we always are able to choose how we respond. Even, so this is the part, even when we choose not to respond, right? We have made the choice not to. If I have clients who say this, Anthony, I have no choice but to go to work. But you see, what need are you actually meeting? And because you want to meet those needs, you have made the choice to go to work. It is not about no choice. You have already made the choice, in fact, right? We all choose how we respond. And the third myth is that we ignore feelings in choice theory. We ignore past trauma and experiences. Not true. In fact, later when we talk about total behavior, you will know. We may not have direct control over feelings, but we can influence through our action and thinking, right? And we honor our past because this past brought us to where we are today, right? It tells us not just about, how we became who we are with some flaws and all these things, but it also talks about really having the strength, the qualities. We all lived and still living. We are here now. What does it say? It says that we have certain qualities and strength that brought us here today, right? And for those of you who are struggling with mental health, you come in here, what does it say about you? It says that, hey, you want to get better. You are taking that step. Can you acknowledge that, right? You don't want your trauma, you don't want your experiences to hold you back. What does it say about that? You do have strength. You look forward to a better mental health. Choice theory is a very cognitive therapy. I have many comments about that. But in fact, this is the part that I want to emphasize. If you really dive deep, it is more of an integrative psychology, right? A lot of people do it so cognitive that really don't deep dive into it, right? So it encompasses, if you can really understand, it can go into the you can explain the psychodynamic, the CBT, the SFBT, the IFS framework. It can encompass all those concepts, right? So this is the part that I'm trying to explain. When we talk about the past, this is the perceived world. When we talk about your motivation, this is about your quality world, right? When we talk about congruence, we are talking about this total behavior car. The four wheels of the car, which is the acting, thinking, feeling, the physiology, are they aligned? And for example, what do I mean by congruent? When you talk about something very sad, but you don't express sadness, you don't even tear, and then you tell me that you are numb, you don't feel, that's not congruent, right? Usually, when we talk about something sad, generally we feel something. If we don't feel that's something that needs to be explored, right? And then we talk about basic needs. With the basic needs is actually the driver, more than the goal itself. It is a driver, really the deep motivation to bring us where we want to go, right? And then we have the feeling wheel. The feeling wheel that talks about what? That talks about um how are you really experiencing life, and how does it affect you, who you are as a person. And for those who have experienced psychosomatic symptoms, like for example, right? You talk about having stomach ache when you need to present, right? Or you have unexplanatory pain. You keep having that pain, but you go to so many doctors, but you cannot explain it. That's the physiology, right? So it can explain all those things. And of course, all those things, if you are coming in as a practitioner who wants to really and very interested to learn, this is what I will bring you through. So don't worry about it. Yeah. So then what happened? We are going to talk about something very important, and that is something called the quality world. So what is the quality world? Our quality world in choice theory, I'm not going to talk about the the whole brain chart, because this whole brain chart that you will have to go through the whole 5 stages to be very competent about it. But what I'm going to focus is just quality world and the five basic needs, as well as the total behavior. These three things, right? And we all actually have this very unique internal picture album. Okay, this word picture album. And if you look at this part here, there's a picture of a mother carrying a child, right? What does that mean? That means that, from birth, our mom is already someone who is really important to us. So the picture album contains things we want most, right? Which includes our deep desire, our goal, also our values, right, in life. It can also include um, memories. It can include places of importance, of significance, right? When what we are, actually receiving, we call them the perceived reality. What we are actually receiving does not match what we really desire or want. We then experience something called distress or frustration. Okay? And why this is important? How we all have what we call a very specific picture in our quality world. And if we don't have, like for example, if each of us if you come to me and you tell me that, Anthony, I want to be happy, the first thing I will ask you is, what is your definition of happiness? And how do you picture that happy life? What needs to be there? If you cannot paint a picture like that, we have a problem here. What's the problem? You see, happy, it's very subjective from a person to another person, right? And because we cannot define happiness, how do we even get there? And so the more specific you are able to identify your picture, the more you are able to attain it, or easier to attain, because now you know what you are actually seeking for. But most of us, when we sit down, it's very what we call schematic. Hey, I want this, I want that. But why? What is so important about that? Ask yourself. And how come that important? Right? If you don't have versus you have, what difference would it really make in your life? Right? And the 5 basic needs, okay? The survivor. The survivor here, we call it is usually for safety. We want predictability. We want security. These are the 5 basic needs. The thumb represents safety because the baby sucks the thumb, right? To get comfort, to get security. And then we have freedom, which is represented by the index finger, because we talk about choices. I want this, I want this, I want this, I want this. It talks about autonomy, it talks about independence. The third one, we know what this means. Yeah. So I'm using things that we are familiar with. This is power, but it's not bad power. It's about feeling important. It's about recognition. It's about achievement. It's about competence. It's about self-worth, not self-esteem. Remember that. It's about self-worth. How much do we value ourselves? Okay. The fourth It's the ring finger that represents love and belonging. It's about cooperation, involvement, the care, the trust, the connection. And the last, we have the fun need. Why do I use the baby finger? Make a guess? Okay. Just a joke here, yeah? We dig our nose with our baby finger. So it's for fun, it's for leisure, it's for relaxation. Okay. So that you won't forget. Okay. So the brain has two parts. One is what we call the survival brain, which is actually the first part of the brain that is developed. We call them the old brain. And this brain takes charge of what we call the physiological needs. And therefore, this is very important. When we don't feel safe, we are very triggered. This is the part that we are triggered. Why here? Because there is something called the amygdala there. That when we are triggered, the amygdala triggers a fight, flight, freeze, and something called the fawn response. Okay, fawn meaning to say placating, fawn meaning to say that the pleasing behavior. And then the rest of the four is what we call the psychological needs. And Dr. Glasser says this, and that's why he says that all long-term psychological problem has to do with relationship. Because love and belonging is the prerequisite to meeting all other needs. We feel safe, comfort in numbers. We feel that security. From where? Because we are in numbers. We belong to. Right? And therefore, we will feel good enough. We can proceed. We can do our things. Right? If people don't trust us, and every time we are very conscious and cautious, we don't feel safe. Right? Life is not fun because you keep thinking about what people will be thinking about me. Right? And therefore, your love and belonging is not met. All others can be quite hard as well. I hope that makes sense. Yeah. And so this is an iceberg for some of you who are quite familiar with Satir. This is quite related, and I'll explain to you, right? I have a friend who does Satir therapy, and we talk about Satir a lot, and we talk about CTRT also, and we actually feel that, hey, actually they are very similar in some ways, right? They complement each other. What happened here? All we can see, okay, so all this white part is above the water. All we can see is actually the behavior part, right? Obvious behavior, which is acting in the total behavior. Remember the four views? The acting view, right? And beneath that is something called the 7 disconnecting habit, right? We sometimes don't see ourselves doing because, why that? What are these? We are criticizing, we are blaming, we are complaining, we are nagging, we are threatening, we are punishing, we are bribing. We may see our behavior, but we see it as okay to do. Why? Because we take it as we are trying to meet our needs, right? We are even subscribing to one of the 3 core destructive beliefs. I'm doing this for your own good, right? You should thank me, right? So and sometimes we may even use this disconnecting habit on ourselves. Like we criticize ourselves because we want to, as a way to cope, because it helps us become better, because I don't feel good about myself. I feel I'm a failure. And so if I criticize myself, I work harder, overcompensate, right? And become the person I wish that I could be, right? And the feelings, oftentimes you hear feelings like, I'm very confused, I'm very lost. These are what we call state of mind. They are not what we call feelings about the feelings, just basically basic emotions like sadness, fear, anger. If you have watched Inside Out, this is where we want to talk about. You may be confused, but you may be sad, confused. You can be angry, confused. You can be fearful, confused. Can we talk about it? So you see how in CTRT we go layer by layer to really understand what's going on. And the perception, remember we talk about the perceived world? You are feeling this way. How are you looking at yourself, the people around you, and the world? The world is a big bad place. People all don't like me. And so I'm a failure. I'm disliked by others, right? So this is the perception maybe we have subscribed. The values, aside from this, what is really important to you, right? The values that we hold, the desire to meet the real unmet need. You see, what do I mean by that? So give an example. I have clients who always thought that their behavior is meeting something. Like for example, they try very much to earn recognition within the company, right? And this is the coping, remember? But how come they need always to find that recognition? But even when after that, even when the company gives them a lot of award, promote them, they ask themselves, I'm not happy still. Why? Deep beneath is the pain and frustration that they have subscribed to because they feel that I'm not worthy even when people see me as that. Right? So the need to want to be worthy, the self-worth, the power. And what's the picture of self? The picture is confident, worthy people like me, but I couldn't get that. Right? And so beneath the surface, what are you really meeting? While we consciously try to pursue certain goals in our life, sometimes our behavior are not really effective, in fact. And that causes us a lot of frustration. And we have behaviors like what we call safety behaviors, like procrastination. Procrastination is actually a safety behavior that prevents us to see the ultimate outcome of maybe I will fail, right? Or you procrastinate because you want freedom from something, wanting freedom. Freedom from what? Not doing, right? And what might you actually be trying to meet? Is it power over your time, avoiding perceived failure, or something else, right? And I'm just sharing this because a lot of us see our pain, but we don't see what's our strength of our needs, which is actually why we do what we do. Remember, I was talking about that particular client who was working and working to try to get promoted, right? She thought that by getting power, that's what she needs. But whole and behold, underneath it, right, her actual need. So just now the sense of self-worth is actually what we call unmet need. Unmet because growing up, it was a very difficult experiences. They don't get validation and so on and so forth. But deep down, what they are trying, we call them the strength of our needs or the profound need, right, is love and belonging. And when I do something like this, where I did a profiling test with them, I found out that hey, this person's power is actually very low, so it's easily satisfied. Which means what? I go to you, I say congratulations, good job. You feel good already. You don't even have to have the promotion. But how come she's still chasing and chasing and chasing and chasing and chasing? That's because it is about this, and this one is unmet, but they don't see it. So they are trying to meet their love and belonging need through meeting their power. Okay? It might be confusing, but if you do come for the actual training, I will explain to you very clearly, right? And so this is the part that just now you saw the very busy brain chart, right? This is a snapshot of it, right? We call this the total behavior card, right? It explains that our behavior is all interconnected. I have clients who say, Anthony, can you just remove my emotion? I can't. I can't. Why? If I remove your emotion, you can only do that surgically, right? In the past, back in the 60s or 70s, people has done such a surgery before. They become vegetable, right? They got no expression. Yeah. Okay, that's not something that we want to go into, right? But I can help you be more congruent and more accepting with yourself, right? Honoring all four parts of the total behavior card and help you learn how to get closer to what you really want by helping you to suss them out, right? And how do we do that? Of course, before you go there, you have to ask yourself, is whatever that you are doing right now really helping you or breaking you down? If you're so self-critical, if you always blame yourself, is it really building you up or is it destroying you from the inside? And if it is, can we stop? Can we try to respect yourself more, encourage yourself more, take on this 7 collecting habit? Mhm. I call this rentals because, um, a lot of times we say that we can't trust people. But in order for us, imagine, in order for me to get a house, I need to take the risk to make the down payment, right? To pay to get a house. If you don't pay me, or if I don't pay the landlord wouldn't even want to give you a roof over your head. So relationship is about also taking risks to trust. Can we try to take a bit of that risk? I know it's hard, but sometimes that unfortunately that needs to happen. Because if we don't, we will never know We will never know the outcome, right? And we don't have direct control over the emotions and body sensation, but they tell us a story about the person, great story about the person. Even though it is a hurtful story, it's a painful story, the story encompasses growth, qualities, strength. It's about how the practitioners are able to use the questions in CTRT to help suss them out, to help fish them all out. But what we have direct control over is the behavior and the thoughts. But we can use this tool to influence the feeling and the physiology indirectly. Subsequently, we hear the story as practitioners that help to surface those strengths, those qualities, be more compassionate, and take some action. Reframe the thought, help to shift this. We also surface what they want in life. We help to craft, we help them decide on a better, more effective behavior to reach the goal, to reach what they really desire, which is actually the purpose. So applying choice theory, right? This is the last part. Yeah? So reality therapy really focuses on empowering individuals to make choices. And what's the difference between reality therapy and choice theory? As I shared earlier, choice theory is about the concepts, the key ideas, and reality therapy is using the concepts and the key ideas to help and then subsequently creating a framework that will help client be able to move or even use it on yourself. I have successfully teach my client to use the framework on themselves. Okay, I have a client who's now in Sydney, and he says, Anthony, every time because of what you have done, in session, 6 months, 9 months, every 2 weeks he comes in for a session. I ask a certain the question in a certain fashion, and because of that, he remembers, and that's how he internalizes. And because he internalizes, the therapy sticks with him even 9 months. And today, right, he is actually studying law, and he's almost graduating. Right? He gave up law degree many, many years ago and he went back to school at the age of 42 or 43, I can't remember. Yeah, he went back to re-pursue what he really wants. Right? And this. So choice theory explains why we behave a certain way, right? So reality therapy is the practical counseling approach. So what do? We ask these 4 questions. The WDEP framework. What do you truly desire? What do you want in life? What matters? Okay, the framework is a framework, but the question may change. There are different questions. And so if you do come for training, I will teach you how to ask those questions. You get very good at it, right? What are you doing? And is what you are doing working? Is what you are doing really getting you what you want? And what will you do differently? Or do you plan, right? So the procedure that leads to change are based on the assumption that human beings are inherently motivated to grow. So choice theory is a very strength-based therapy too. It says that you are your captain of your own ship, and we believe you can. Right? It's very empowering. So the W question can be like this: what do you want? What is your goal? How do you want your class to be? When was the last time you were happy? And what are you doing right now? What actions have you taken? Right? The E, is it helping you, not helping you? Is it building you up? Is it destroying you? Is it is it is it getting you closer or further away from what you want? Are you satisfied with things? And what, where, when, how are you going to do this? What would you commit yourself to for the rest of the week? The P is about planning. But before we go into the planning, I want to talk a little bit about this, the E. And Dr. Glasser says this, for those of you who are planning to maybe take on this training in the future. He says that the key to change is actually in the art of self-evaluation, how we ask questions to help them evaluate is the art. And this is the difficult part. A lot of us are very good. A lot of practitioners are very good at unpacking a lot of pain, talk a lot about problems, but they don't know how to help the client navigate. And so in CTRT, I will teach you that, right? But it involves from 3 perspectives, the self, others, and the context, right? Why? Because this prevents bias, leads to truly meaningful insights within a client. We are not telling the client what to do because we believe client already know. It's just sometimes because of whatever that is happening in their life, it's harder to think. But our job is to sit with them, slowly surface them out. Okay. And walking the basis of self-evaluation in a very systematic way to ensure thorough evaluation. What is that? The first base, what is my goal or client's wants? Second base, observe, what did I see in the client or what question did I use? The third base, what's new? What kind of behavior emerge? And finally, what will be done differently, right? Why is this self-evaluation so key? So imagine if you come to me and I say that, hey, you know that this is wrong, right? You need to change, How would you feel towards me? Very judging, right? Right. And you probably won't come to me anymore. But I will get you to ask yourself very difficult question. And I will always tell that, is it okay if I ask you a difficult question? Would you mind if I ask you something that may be quite personal? Right? Maybe even quite painful. Why? If I ask and you think through it, the likelihood is that you will think twice, 3 times, and even after the session, you will think about it. And it's for who? It's for yourself. I'm not forcing you to change, but because you are evaluating and the question sticks, the more the likelihood of you changing is higher, and it will stick. Okay, if you can ask those questions yourself, they stick, and then of course you have a higher tendency to want to change. And the plan, remember WDEP. The last part is the plan. The plan is about, it needs to be very simple, attainable, measurable, immediate. This is quite similar to your SMART goal. But what is different? It should be controlled by a planner, consistently practiced, and really committed, right? And this is very different because most of the time, sometimes when you go to a practitioner, they may say, oh, you don't have motivation to lose your weight, for example, right? Why not tomorrow start to do a run, 100-meter dash, do for 10 minutes, right? Would you do it? Very hard, isn't it? If you have been at home for the longest time, how would you do it? How do you get the energy to want to do it? It's very hard. It must be simple. If you have been staying in your bed for the longest time, can you roll out of bed first? Right? What would be good for you? What is something that you personally would be willing to do and committed to at least an 8 out of 10? Okay, you're willing to take, maybe even stand outside your doorway. Why not we do that first? Right? Can you do that? How often can you do that? Do you want to do that for 1 week? Is 1 week too much? Right? We ask the client, okay, do you think 1 week is something attainable by you? How committed are you to do that 1 week? If not, then can we do what is more realistic then? Say 3 days in a week. Okay, why not we do that? Right? And those are important. Right? Your path to a fulfilling life goes back to really focusing on the present behavior and the future goal, but by asking yourself, is what I'm doing right now helping me or not helping me get closer to what I really desire, right? So we need to focus on what you can control and not what we cannot control, and really build effective plans around it. And Dr. Gasser said this, we almost always have choices, and the better choices, the more we will be in control of our lives. Okay, thank you very much.